Already, local Red Cross volunteers are on the ground helping to make sure those affected by the wildfires have their most basic needs met first. Joe McCoy spoke to one of them today.
As the devastating California wildfires reach day 5.
Hey, bring the engine right here.
19 Red Cross volunteers from Minnesota and the Dakotas have made their way down to help.
I'll be staffing the shelter as a nurse overnight at one of the more larger shelters we have operating right now.
This is Ryan Bohera's 6th deployment with the Red Cross. The Victoria, Minnesota native will be in California for 10 days, making sure those in need have medications, walkers and canes, and receive any other medical care necessary.
The fires are very unpredictable right now. I think they got some control over last night, but there's concern with the winds that it could shift and grow.
How important is it to help people not only with medication and the basic needs, but also the mental health and the emotional side of all of this?
By providing those emergency services and mental health, which the Red Cross does, and spiritual care, we can better support them to be able to get past those recovery roadblocks. And that's what we're about, is helping them to be successful when this is over.
Right now, the end is hard to see, but these images show Red Cross members doing all they can in the moment.
Right now, the Red Cross has 9 shelters open. Last I heard, it's a constantly changing situation. And last night, we had more than 700 people staying in those shelters.
Minnesota Red Cross Chief Development Officer Megan Steffer says the public can assist through donations and by donating blood, which is critical in disaster situations.
Wildfires are an especially terrible disaster because things are constantly changing and they're very unpredictable.
Steffer says the Red Cross also has people in California who specialize in what they call reunification. And this is the process of helping reconnect families who may have been separated during the evacuation and whose normal communication methods might not be working.